through these years, I've been focusing on the cure of patients and treating patients and helping families get through the aggressive treatment, which lasts 2.5 to 3 years at the present time. But you can imagine that people, when they come in with their child who has leukemia, that once they deal with what does this mean, what is the prognosis, how do I treat my child, how will the doctors take care of him, what kinds of toxicity are associated with the therapies that we give my child. Will they be in the hospital? Will they be able to go home? Will they be able to take trips and vacations? This is a long period of time, 3 years, that the children will be under treatment. And then they begin to think, sometimes on the first day, but oftentimes a few days later after a diagnosis, they wonder, why does my child have leukemia? What have I done? Did I paint the bedroom at the wrong time? Did I take some medications before the child was born? Were there things in the environment that maybe affect the chances of my child having leukemia? So these are just some of the questions that parents have asked me over the years. These are important questions that a doctor needs to have some knowledge to be able to answer. We, faced with this, have looked at a large number or asked a large number of physicians to participate in a survey about just what kind of factor they think the environment is in the incidence of cancer and acute lymphoblastic leukemia that they deal with in their population. We submitted a large survey throughout the state of California and Utah and Massachusetts to people involved in pediatric oncology, the healthcare providers, physicians, nurse practitioners, and fellows studying to be this specialty. And we found through sending this out to over approximately 450 individuals, and almost 50% answered that there were very many questions that parents ask about the environment and its effect on whether or not their child has leukemia or not, and that they oftentimes did not have the information available through their experiences to be able to answer those questions, and felt that it would be a very important part of their education to understand what these environmental studies have shown regarding acute lymphoblastic leukemia.